8 strange warning signs of kidney disease that might seem like something else. Over 35 million Americans have kidney disease, and most don't even know it. That's because kidney disease is often silent, or when you do get symptoms, they can be tricky or really just hard to figure out. Your kidneys are like your body's cleanup crew. Yes, they filter 200 quarts of blood each day, and they get rid of toxins, they get rid of excess water, they help to balance your electrolytes, and they clean things up. The issue is that sometimes the kidneys don't function properly. And yes, when the kidney cleanup crew is not working efficiently, it will let you know. But sometimes, again, those symptoms aren't obvious. But don't worry, because I'm here to help you to crack that kidney cleanup crew code. Let's talk about these 8 strange warning signs and symptoms of kidney disease. Number 1, dry and itchy skin or rashes. Yes, if you have kidney disease, you can definitely get dry and itchy skin. That's because your kidneys are responsible for filtering out excess toxins, but when you get a toxin buildup, it can literally lead to just dry skin or irritated skin, and it can really break that nice skin barrier that we all have. Another thing is that the kidneys are responsible for filtering out excess phosphorus. And phosphorus is something that's found in nuts. It can be found in milk. It can be found a lot in processed foods. Okay. It's a preservative. When your kidneys aren't working as well as they should, you can get a buildup of phosphorus in the blood. And guess what? Phosphorus can make your skin itch. Okay, my patients will just be scratching and scratching and scratching, and I'll check their labs. Oftentimes, they have high phosphorus. Certain nutrient deficiencies can be associated with kidney disease, like zinc deficiency or deficiency in some of the B vitamins. This can certainly lead to dry and itching skin. Also, for patients with very advanced kidney disease who are already on dialysis, well, when that dialysis filters out your blood, it can sometimes, unfortunately, filter out certain vitamins and certain nutrients, and that can also lead to dry and itchy skin. Dry and itchy skin can be a warning symptom of kidney disease, but it can be confused with other things like eczema, psoriasis, skin infections, allergic reactions. Just make sure you consult with your doctor. Number 2, bad breath. Y'all, I do not want to be rude. I don't, but it's true. Some patients with kidney disease will have a warning sign of bad breath. I mean, I can have patients who walk in, and sometimes just by the smell of their breath, I can tell that they are in uremia. So here's what uremia is. Uremia occurs when you have a buildup of toxins, specifically urea, because the kidneys aren't working well and they're not filtering it out. And so if you have bad breath from advanced kidney disease, then your breath can literally smell like urine. I'm not kidding. Okay, so here are some things that the bad breath might be confused with. You might confuse bad breath from kidney disease with bad breath from poor oral hygiene, or for people who have diabetes that's poorly controlled, like diabetic ketoacidosis. Sometimes they can get a strange, like ammonia smell to their breath. Also, it may be confused with people with gastrointestinal issues, stomach issues. Like sometimes for people who are constipated or backed up, they can get a bad breath. Sinus infections, that can sometimes cause a bad breath as well, and just other dental issues. The point is, make sure you consult with your doctor because bad breath could be one of those strange warning symptoms of kidney disease. Number 3, less energy or trouble concentrating. So yeah, this can definitely happen with kidney disease because when the kidneys aren't filtering properly and you get a buildup of toxins and waste, they can literally make you tired. And I just don't mean the kind of tired that you get when you haven't quite gotten enough sleep. I mean, this is the type of fatigue that no matter how much sleep you get, you always feel drained or like you have low energy. Having trouble concentrating or experiencing brain fog could also be a symptom of kidney disease, especially when you have a buildup that's leading to uremia, okay? When you have uremia, that can lead not only to confusion and brain fog, it can also lead to other neurological problems like tremors. So the low energy from kidney disease and the brain fog from kidney disease can sometimes be confused with other diseases like anemia. Although I will say that if you have advanced kidney disease, it can lead to anemia. Ooh, let me tell you how. Your kidneys are responsible for making a substance called erythropoietin. And this erythropoietin stimulates your bone marrow to make red blood cells. Well, when you have kidney disease, especially advanced kidney disease, then you don't have enough erythropoietin. So you're not stimulating enough red blood cell production. And so kidney disease can lead to anemia. But of course, you can have anemia and not have kidney disease. Okay, other things that the low energy or brain fog associated with kidney disease might be confused with are thyroid disease, depression, chronic fatigue syndrome, menopause. Number 4, nail changes. Now, this is a good one because nail changes really can be a strange warning sign that can be confused with something else. All right. A classic nail change that can be associated with kidney disease is the half and half nail or the Lindsay nail. This occurs when the bottom half of the nail has a distinct white band, while the top part of the nail, like at the tip, has a darker color, like a reddish brown color. Okay. That could be a warning sign of kidney disease. It can be confused, however, you have to be careful with other things that can cause darkness in the nails, like melanoma. Okay. That could be very serious. Skin cancer can present as a dark or black type of a discoloration under the nail. Also, it can be confused with bleeding under the nails, like some type of a hemorrhage or a splinter hemorrhage, okay? With a half and half nail, Lindsay nail, is a warning sign that you could have kidney disease. Other nail changes that could be associated with kidney disease include yellowish nails. Yes, if you have yellow nails, make sure you consult with your doctor because it could be kidney disease. It could also be confused for something else though, because if you have an issue with your lymph drainage, that could cause yellow nails. Also, a fungus infection could cause a yellow nail. Merkey's lines are other nail changes that can be associated with kidney disease. And these are like white lines that run parallel to the finger. Now, they can be confusing because they can seem like something else because Merkey's lines can also be associated with low protein in the diet, with liver disease. But definitely, if you're having these lines on your nails, talk to your doctor to make sure it's not kidney disease. And some other nail changes that are not necessarily associated with kidney disease, but could be confusing. If you have pits in your nails, the pitting nails are usually associated with psoriasis, not kidney disease. There are also spoon-shaped nails, and those tend to be associated with anemia. And by that, I mean the nail literally looks like soft and like a little spoon. That can be associated with anemia, but of course we know that anemia can also be associated with kidney disease. So still consult with your doctor. And then if you have brittle eggshell nails, meaning the nails are like really white, very thin, and they break very easily, that could be associated with kidney disease if you have malnutrition, okay? These eggshell nails are usually associated with malnutrition, but of course, with advanced kidney disease, you can get malnutrition. Bottom line, if you're having nail changes and you're just not sure, consult with your doctor to make sure it's not a warning sign of kidney disease.